Hello and welcome. مرحب فيكم جميعا. اليوم موعدنا مع الدكتور زين حسيني والدكتور بلال حاج نجيب بمحاضرتهم من ضمن المحاضرات الأسبوعية للدورة اللي بتقيمها مبادرة أطباء عيون السورية. اليوم نحن حظنا عالي إنه راح نستضيف مس نيكولاس كويلتر اللي هي مسؤولة الإكزامينيشن تبع Ophthalmology Foundation. هي رح تشرح لنا شوي على الفحوصات، على الامتحانات، رح تشرح لنا شو الفايدة تبعهم، رح تحكي لنا شو الميزات تبعهم، وهي بتسمح لنا نعمل استثناء بأي امتحانات وبأي يعني الزمالة مثلا بكلاسكو بإدنبرا. بنصير نستثنى من بعض المراحل في امتحاناتها عن طريق تقديم الاو اف. كمان في عنا الفيلوشيب كمان بتقدمها الاو اف مشان هذا الموضوع. Ms. Nicolas Quilter is the examinations director at the Ophthalmology Foundation, bringing over 20 years of experience in the delivery and governance of high-stakes ophthalmology examinations. She has extensive expertise in examination development, quality assurance, and international assessment standards, with prior experience working alongside the International Council of Ophthalmology, ICO, and COE CSA. Nicola is widely recognized for her commitment to excellence, fairness, and innovation in ophthalmic assessment worldwide. Welcome, Ms. Quilter, please.
Thank you, Dr. Nabari. It's a pleasure to speak with you this afternoon. I'm going to talk a bit about the Ophthalmology Foundation, and then primarily I'm going to discuss the examinations, which is one of our new initiatives and programs. So next slide, please. So the Ophthalmology Foundation works with eye care professionals, societies and organisations to enhance and provide ophthalmic education, with special focus on low resources and underserved countries. We're helping ophthalmologists become better teachers, and we're providing training opportunities through sponsorship and fellowships. The Ophthalmology Foundation is committed to strengthening ophthalmic education with the ultimate goal of improving eye care and advancing the preservation of restoration of vision for all. Next slide, please. So at the heart of our Ophthalmology Foundation is our International Board and Exams Committee, with members from all over the world. They ensure our programme remains globally relevant and fair. The board includes many senior ophthalmologists and individuals from industry, which is also important for the structure and the organisation. Next slide, please. The Examinations Committee have individuals also with over 20 years experience of education and international examinations, with some also representing the Royal Colleges in the UK. And as it's important to have a wide variety in the committee of different regions, because our exam is international and we look at perspectives from all different areas. Next slide, please. So we have 4 key programs. We have faculty development, accreditation, fellowships, and examinations. I'm going to talk primarily about examinations, as I said, but I think it's important to show the other 3 programs, one being fellowships, accreditation, and faculty development. So fellowships, we run around 100 fellowships a year. They're international, and they are observerships and fellowships, a mixture of both, where you get a hands-on experience. And we have faculty development, which is providing tools and techniques for resources to improve ophthalmologist eye care professional and education activities. And then we have a review process of ophthalmology residence training program within the institution for surgical and non-surgical programs. We believe that these 4 programs work together. So we believe that you are training to be an ophthalmologist, you're going through your rigorous training, and then you are taking one of our examinations. And I'll explain the benefits of that in a moment. And then once you've applied and you're successful in an exam, then you can move on to your fellowships, and then faculty development, and then accreditation. So we believe the 4 programs work hand in hand. Next slide, please. So I think it's important to say that we're working with the Wills Eye Hospital in the US and also the Wilmer Eye Institute in the US. We've been working with them closely and they are fully supportive of our initiative. We just have two sittings for the examinations. We have the 25th of March this year, with the application process closing on the 31st of January. And then we also have a sitting in September. We run these exams because they serve as critical, several critical purposes. They set and maintain high standards of ophthalmology across the globe. They benchmark the knowledge and expertise of professionals at all levels. And we're supporting the career of the ophthalmologist's progression. And most importantly, we believe that patients in turn then receive the best possible care. The exams importantly map to the BCSE, to the basic curriculum and clinical curriculum, and we provide a suggested reading list and materials via the website. In addition, we are collaborating with Cybersight as well to create a dedicated portal, which is a prep for candidates to further prepare for taking the exams. And next slide, please. So the exams, we offer the exams visual sciences, optics and refraction, and clinical ophthalmology. I'll talk a bit more about those in a minute. But we recognize there's a recognized certificate that enhances your professional credentials. The content, as I said, is created by a pool of international experts in every subspecialty, which means that it's up-to-date knowledge, it's clinically relevant, and it allows you to compare your performance with others in your institute, and also allows your institute to compare with a international standard. It's globally recognized, it's criterion referenced, and it's ANGOT method standard set, and that is by the exams committee. And we also have a David and Molly Pyatt Foundation travel grant, which is $10,000 awarded to the top passing candidate of the clinical ophthalmology exam. I had the pleasure this year of being the person to phone the awardee. He was actually a trainee that trained in Ethiopia and then passed and took them past the exam in Rwanda, and he was a top candidate. He was awarded the 10,000 grant, and he has chosen to attend the American Academy in New Orleans this year and then extend his trip on so that he can get some experience with an organization in the US. So it's a great opportunity to be able to, if you're able to participate in the clinical and then you're a top passing candidate. Next slide, please. So what are the benefits? It's flexible, it's online, so you can take the exam in your country. And so that also limits your costs. So you don't have to travel. You can take it where you are. We've got 100% success rate. So if a candidate goes onto our website, onto our exams platform and is unable to find the exam centre in their location, they can click other and then type where they'd like to take the exam. And we've been running now for 2 years successfully. We've been able to find everyone a exam centre, not too far from their home. You can benchmark your institute and your trainee performance locally, nationally and internationally. It's cost-effective pathway to other exams. So we pride ourselves on the fact that we are less than half the cost of any other international ophthalmic exam. And we based our fees on the World Bank Index, and they're reduced fees, which I'll talk about in a moment, for trainees in Syria. As I mentioned earlier, we run a fellowship program, which everyone is welcome to apply for. And by passing the Ophthalmology Foundation exams, you gain points towards your application for a fellowship. As we say in the UK, the more points you have, the more prizes you get. So the more points you have when you're applying for a fellowship, the more chance you have of being successful. We also award you, after successful completion of the clinical exam, the post-nominal acronym of FIOF. So you become the Fellow of the International Ophthalmology Foundation. And this shows that you are working to an international standard. As I mentioned, you have the David and Molly Pyatt Award. And as I said before as well, we believe that this enhances the quality of patient care. Next slide, please. Thank you. So we run 3 exams. We run visual sciences, which is 120 single best answer questions over a 3-hour period. Optics, refraction and instruments, which is 60 hours over 1.5 hours. And clinical ophthalmology, which is 160 questions over 4 hours. You receive 1 point for each correct answer. And I'm pleased to say that there is no negative marking. So if you are unsure of a question, you can move on and then go back. And if you're still not sure, the best advice that I can give you is take an educated guess, because there are four single answers, one correct answer, and so you've got 25% chance of getting it correct. So if you're unsure, then make sure you do answer. As you will see, we cover all subjects, and these are weighted, so there are not necessarily an equal amount of questions in each one, but they are weighted with regards to relevance of training. Next slide, please. So here's some examples of questions. We understand that we are for some English is not the first language, and so therefore we're not trying to test language, we're trying to test knowledge. So you will see that the questions, although they're different, they are quite repetitive in the way that we ask. So for example, this one here is regarding the blood-retina barrier. Which one of the following statements is most likely to be true? So when you're moving through the exam paper, you will most probably see regarding and then the subject. So regarding glaucoma, for example, which one, so we're looking for one correct answer, of the following statements is most likely to be true. That means there could be two answers that are possibly correct. We're looking for the most likely. You'll also see from A to D that they're alphabetical order. Again, it's much easier for a trainee candidate to have them presented in alphabetical order when referring back to questions and trying to recall knowledge. Next slide, please. This is another example. This is from the optics and refraction paper. These questions were used in a previous paper. And so the type of questions that you'll be presented with, again, which one of the following is the orientation of the streak of light when performing retinoscopy for astigmatism? Again, you can see the pattern. Again, A to D, alphabetical. One correct answer. On the online portal on the system, you'll be able to just select one answer and then click next and move on to the next question. You can revert back if you wanted to change something, or if you're unsure, but it's a very easy system to use. And next slide, please. Our clinical exam, as you can see, usually has a clinical scenario, and then we present with photographs, or the system also allows us to use videos. So sometimes you can have eye movements, so quite interactive. But again, as you can see, A to D, alphabetical, easy to use if English is not your first language. We do translate currently into French, Spanish, Portuguese, Chinese, and if there was a need for another language, then we would obviously review depending on obviously demand. Next slide, please. The exams have already made an impact and a real difference. So many candidates in dozens of countries have taken them, advancing their careers and raising care standards. In many undeserved regions, they're helping ensure that patients receive better ophthalmic care. I was lucky to be in America last year for the American Academy meeting, and I met one of our candidates that passed in March, and they said passing this exam opened doors they never thought was possible, and that's because they then went on to apply for one of our fellowships, and they're actually later this year participating in the 3-month fully sponsored fellowship in Germany. As you can see here, these are some of the candidates' experience. Again, all international candidates. Just to go back, and I actually didn't mention the fees. The fees for the visual are $125. They're $100 for the optics and refraction, and $160 for the clinical ophthalmology. We do understand that this is a cost, an additional cost to part of your training. So we've also implemented a 3-way payment system into our online portal, which means candidates can go on, they can apply, and then opt for the 3-way payment system, which means they pay a third of the fee when they actually apply, and then subsequent to that they'll receive an email in the next following month, and they'll pay the additional third, and then in the third month they'll pay the final payment. So there is a payment plan where you can spread the cost over a 3-month period. Next slide, please. We're not a membership organisation, but our impact is strengthened by our partnerships. We work with a lot of prestigious organisations, like I mentioned, Wills and Wilmer in the US, and we're working with the African Society, COEXA, the PAO, and also the Young Ophthalmic Society of India. And we're building strong relationships. We've signed several MOUs, as you can see here from the list, with the Turkish, the Mongolian, Nigerian societies, and we're continuously seeking new collaborations with societies and organisations to strengthen our global reach and impact. We believe that these partnerships help expand our reach, ensure our relevance, and build stronger global community. And I think that's important as well. Ophthalmology, the world as we know it now, is quite small, but ophthalmology is also quite a small subject. And what we're trying to aim to do is connect ophthalmologists from different countries, different regions, so that it brings it also closer together, and that we're all working for one goal. Next slide, please. And these are some of the further ones that we've signed. We're actually also in discussion with the Royal College of Ophthalmologists, Physicians and Surgeons of Glasgow. And that is, we've had 2 successful meetings, I think it's important to say, and we're having our third to look at standards at the beginning of February. And the hope of that is to have reciprocity with Glasgow, which means that candidates would be able to take our exam or their exam and then move on to the second parts of each one. So I think if you took and passed our visual and optics, then you would be exempt from their part 1. That isn't confirmed at the moment, but we are in discussion. Next slide, please. I think looking ahead, we have ambitious plans. We aim to reduce the cost of these exams even further, add more partners globally, increase access to undeserved regions, and expand our offering with additional fellowships and subspecialty exams. As of September, we are running a retina and a glaucoma examination. And then from March 27, we hope to then add additional. These will be 120 questions over a 3-hour period, and trainees who have passed our clinical exam or equivalent will be able to move directly to the subspecialty exams. I think it's also important to say that obviously we have partners and we have candidates, and it's important to listen to both. So if you have any feedback or ideas of what you'd like to see from us, then please let us know, because your input helps us to continue and evolve and improve. In summary, the Ophthalmology Foundations are the heart of the exams are what we do, setting up and holding the highest standard in ophthalmology and empowering professionals to grow and improve outcomes of patients worldwide. Every candidate who takes our exam becomes part of our global community, committed to excellence in eye care. I'm very proud of what we do. The team are very proud of what we do, and what these examinations have achieved so far. And we are determined to make them even more accessible, relevant, and impactful in the years ahead. We hope to see your applications coming through. There's a link there via the QR code. We are modern, efficient, and affordable, so please keep that in mind when you're looking at our exams portal. And if you have any questions, then myself, Vicky, Rosie, who are the exams team, are more than happy to help. But I'm happy to answer any questions. Thank you.
Excellent. Thank you very much indeed. I have to say one word and then we go to questions. أريد أرحب بالدكتور السيدة العيون، رئيس شعبة عينية بمستشفى المؤسسة الجامعي بدمشق. الامتحانات، امتحانات الأوف عم تقام في كل 6 أشهر عندهم بالمؤسسة، هذا المركز المعتمد. ونتشكر جهوده، هو معروف بتفانيه وطول الوقت عم يجتهد لحتى يطور القسم ويخدم المقيمين في كل سوريا. I think there's a question from one of the audience. They're asking, what's the difference between the ICO and the OF? Myself, I know that I think OF is a bit less expensive, but I leave this to the experts.
Yeah, that's fine. It's a really good question. So I actually worked for the ICO for 12 years. So I know the difference. And the difference is one, it's cost, and that's true. So we're half the price or less than the ICO. We also are of the highest standard. So the standards of the ICO are high, but we offer exemptions. So if you have passed an ICO exam prior to and including 2022, then we will exempt you from our visual and optics. However, after 2022, we are unsure of the ICO standard. a lot of the ICO board and the exams committee have moved over to the Ophthalmology Foundation. We offer more fellowships, I believe, than the ICO. We have over 100 last year, and we're looking to expand that this year. Other than that, and also we were online as well, so you can take the exam online. There's no paper based. We also turn around the results within less than 2 weeks. So our aim is 14 days. I've taken exams, university exams, and the stress of that waiting for results is not nice. So we aim to turn the results around within 14 days. We succeeded 10 days in March last year. Our turnaround in September was 8 days. And so I think that's important to say as well. You don't have to worry about your results. Your certificates are sent out, really nice certificate, embossed, signed by the president and the executive, something proud to be put on your wall. And as I say, we're also working with the college to gain reciprocity. But you don't have to travel as well. We'll find a centre located near you. You can't take it in your living room at the moment, but that may be something in the future. But yeah, with the highest standards, low cost, effective, efficient. Yeah, that's where we're at.
Thank you very much indeed for your time and the expertise and for being with us today.